This is not Wayne's World, by the way, but this is, my name's Chuck, and I am the pastor here at Desert Song Community Church in Redmond. And tonight, we're having a little Q&A on COVID-19, and we have a special guest. Why don't you introduce yourself?
My name is Bruce McElroy. I'm a family practice physician. I go to Desert Song. I used to practice here in Redmond. Now I'm down in Bend in Central Oregon.
Yeah. And have you ever seen the movie They Call Me Bruce?
Oh, many a times, absolutely.
Okay.
It's a classic in our family.
Okay, good. We just wanted to start off on a real solid footing there
Yes,
with
solid.
something that's really, really important. Well, since we're live, we want to encourage you at this time, you could text in or on your Facebook Live or Instagram, you could send in your questions that you might have for us, and we would love to attempt to, well, he's going to answer them. I might make something up. But we're going to get to the bottom of all that, what's true and what's not. And a lot of people have a lot of different questions, and if you're like me, it's hard to make sense of all the information that is out there, and it's constantly not just coming at us, but it seems to be constantly changing. But there are some facts and some pieces of information that have held true from the beginning. And I really feel those are the things we probably should pay most attention to, as well as some of the new stuff that comes out. But the ones that they have repeated, those are the ones to take notice of. But we're just going to go through some questions, some basic questions. Shalene is off camera. She's going to be kicking in some questions to us as you send them to her via Instagram or Facebook. But Bruce, my first question for you, and thanks for joining us tonight, is when did this first get your attention, and why? What captured your attention with it?
In December and January, there started to be some reports about a strange or really violent respiratory infection that was striking people very ill in China. And this stoked old memories and or fears of previous viruses that had come along and had threatened to go as an epidemic or pandemic, and had not to the level that we're seeing now. And then in January, when China quarantined a large portion of their country and a huge amount of people, I couldn't help but take notice of that. And then when our own Centers for Disease Control and the CDC started publishing about it, it was obvious that we need to pay a lot of attention to this.
Yeah.
So.
And so, I mean, it seemed to spread pretty fast over there. Where do you, I mean, they've reported some numbers. Do you think they're anything close to what's going on over there?
For absolutely, for China I do, because they've let our Centers for Disease Control in. They've been exchanging information. I think that there's pockets around the world that don't report fully for whatever reasons, and that's their choice.
Yeah.
It makes it more difficult for the rest of us to learn and do what's right, but we can't cry over that.
And so with China, I mean, the numbers that are coming out now, looks like the numbers are going down for them. Do you have a feel that that's probably accurate then?
It is. It's accurate. They took steps to limit as best they could. They saw a rise, they saw a plateau, they saw a fall. And now as they start to lessen the restrictions on who can come and who can go, they're facing the second wave, or what happens if travelers come in and re-expose people who weren't exposed previously, which is something we're going to have to get to eventually, but that's not where we are now.
Right. And they kind of did almost a full lockdown. They weren't letting anyone in or out. Is that kind of what they were doing?
That's what was reported. I don't think that certainly a lockdown of what China did is possible in Redmond, let alone America. I can't imagine trying to contain my own family, let alone an entire city or most of a nation. So. Yeah,
no, it makes sense. So if you were to give just kind of a definition or explanation, what is COVID-19?
So COVID-19.
For a simple guy like me. Explain it for like me.
Absolutely. COVID.
Yes.
COVID-19 is a new, never seen in humans before virus. It is in the family of the coronavirus. Now, coronavirus itself, in its non-new form, is nothing new. There are strains of coronavirus that circulate through our community every cold and flu season. However, this one is different. It's new to humans. You can say it's mutated. I don't know what that definition would be. That's not my role. But this one, since it's never been seen before and it has such a predilection or tendency to get to the lungs, it causes, and our bodies have never seen it before, our immune system can't handle it. The inflammation that it causes is severe. And most worrisomely, it's so easily spread from person to person if you're not 6 feet apart like Chuck and I.
Whoa, yes.
Sorry.
Yes.
Yeah.
Is it, I've heard some people compare it to like a flu, or say like, well, flu viruses in the past have had more of a negative impact and killed more people and stuff like that. And so I hear this constant comparison game, and some say, oh, it's nothing like the flu, and some say, well, there's some similarities. What's one to make sense of all this?
I think I don't think, in my opinion, the truth lies in the middle. It's hopefully seasonal, like the flu.
Okay.
We hope it doesn't come around every year like the flu. Yeah. But it's different than the flu in a lot of ways. Again, our bodies have never seen this before. The flu that comes around every year switches forms slightly every year, but it's between forms that we're able to track and predict. And the Centers for Disease Control, with help from around the world, every year predicts what to put in the flu shot so that we can help people not get sick. At the same time, because the flu doesn't change dramatically from year to year, we have some immunity from past exposures. This new virus, the COVID virus, we've never seen before. We don't have any way of protecting ourselves against it, and we don't know what it's going to do in the future. It has such a violent response that not a great comparison, but probably the closest comparison in my lifetime is about 10 or 11 years ago, a new strain of the flu came out that was called the swine flu. And when the swine flu came out, it wasn't covered by flu shots. Now it is. 10 or 11 years ago, I got violently ill from the swine flu. I was out for days, and I was younger and healthier, and I still felt like I was in trouble. The swine flu killed more people than the average flu because it was new. This COVID virus, to compare it to the flu for lethality or your risk of death, it is 10 or 12 times more deadly.
Wow.
Than the standard flu. And that's nothing happy about that. So.
Yeah. Of course, if they find a vaccine for it,
Brag.
that will eventually help keep it at bay unless it mutates or whatever word that they use in the medical field. I'm not a doctor, but I play one on TV.
Yeah. And I'm not an immunologist, but what I know is that a vaccine is not close. We have to deal with what we have now.
Okay.
Vaccines take time for safety and for efficacy. And you can cut some corners, but you're playing with the ultimate price if you do.
Yeah.
So.
Why is it you think some countries, like it seemed China, when you consider their population, got a pretty quick handle on it compared to a country like Italy, France, Greece?
Sure.
What's going on in your mind with some of that's playing out in Europe right now?
Looking at China, they were hit with it so hard and so fast. And again, their style of government allows for them to put in some restraints, I guess for lack of a better word, that we can't do here. People wouldn't stand for. And I'm not Italian, I can't speak for that, but I know when I read about the terrible problem that Italy's having, they have the oldest, if not the oldest, the second oldest population in the world. Yeah. They have a very high density living situation. That's a small country with a lot of people, similar to New York City. And some of their social norms are better for passing a virus than others. I don't remember the last time I kissed somebody on the cheek as a way of saying hello. And that's not to be callous, but I think everything has something to do with that. And the role of the extended family in Italy is different than it is here. And I think all of these things played a role. As far as other countries getting hit, high population centers are being hit irregardless of the countries. Without attempting to go into political reasons, which are way beyond me, I'm not even going to try. Healthcare systems have plans in place for disasters, but no one's ready for something like this, in my opinion. It's new, number one. We can't test for something that's new until we've seen it. And as far as stockpiles and supplies, in America anyway, in our lean business culture, we keep just enough on hand to keep things profitable. That set us up for a fall here as well. You can say that's a problem, and it certainly looks like one right now, but stockpiling warehouses full of unused ventilators and masks and gloves for years doesn't make any more sense than buying 1,000 snowplows for Phoenix, because they might get a big snow one year. I don't think the taxpayers would go for that either.
Right.
That's probably oversimplifying it, but okay.
Right, right. Someone pointed out too, and I hadn't thought of this, but it makes sense, and they said about Italy, they said, the size of Italy could probably fit within the state of Michigan. And so you think of
Yeah.
just all those people
Yeah.
crammed in and an older population. It just seems, it makes sense when
Yeah.
you start adding some of those things together, why it exploded like it did, and not having the communist regime of just saying, we're going to shut everything down.
Lock you down?
Yeah.
The other thing that has been pointed out is that Italy has an excellent healthcare system, a world-class healthcare system. It's also free. And so what they say is that not only do they live longer, but they live longer with chronic conditions that make us more susceptible to this virus. The population I work with has great health care and has all these conditions as well. I worry about that as well, because I don't think that we're that far different as far as our life expectancy, and certainly the amount of people out there living with high-risk conditions.
Good.
That was a good lead-in for the next question.
Yeah. Which is, which question am I on now? I can't remember. Four. So who is more at risk?
Right.
Yeah.
So anyone with
Four.
anyone with an immune system problem is at risk. And I'm not looking to offend anybody, but some people won't like this, notably my parents. If you're age 70 or over, then you basically have a pre-existing condition, and that's that as we age, our immune system is not as strong. So people over 70 are at risk, increased risk for terrible complications, including death from this virus. Your risks are more if you have certain other chronic conditions, primarily lung disease. Asthma, even if you treat it and it's well controlled, puts you at increased risk for complications. Certainly COPD or emphysema, smoker's lung, puts you at increased risk. There's other lung diseases that some of you might not have heard of, and if you haven't, that's good, but if I say one of yours, you might want to pay attention. If you have asbestosis or fibrosis or sarcoidosis, you're at more risk from this disease. And anytime a doctor gets in front of you, then I'm supposed to also say, this would be a great time to quit smoking. Because just simply smoking puts you at more risk from high complication from this disease. That all makes sense because it's an infection in the lungs that really everybody knows about. Other diseases that people might not think about that put you at high risk is high blood pressure, even if you take your medications and your numbers look good. Heart disease, even if it's stable, you're on all your right medicines, and I won't list them all. Even if it's stable, you're at high risk. And lastly, diabetes, and even well-controlled diabetes puts you at increased risk, as do several other of these: kidney disease, cancer, chemotherapy, HIV, hepatitis, certain autoimmune disease, and then certain medications that we use for other diseases technically make you immune compromised or immunocompromised. If you have any questions about any of these, one of the lessons that we want to get home is call your doctor. Don't go to the emergency room. Call your doctor. Call your doctor. Most doctors' offices aren't doing face-to-face visits. They'd prefer to talk about this with you over the phone or even a virtual appointment. They might have time right now, but call your doctor if you have questions about these and how much at risk are you. That's the not real quick answer. I have some numbers to throw at you. This story's ever changing. As of today in Oregon, we have 690 cases of COVID-19. That's 84 more than yesterday, so we're growing at a very fast clip. There's been 18 people in Oregon die thus far, and the breakdown is that of those 18 people, 10 of them have been over the age of 80, and another 5 have been over the age of 70. So you have 15 out of 18 that have been in that high-risk age.
Yeah.
That's why they call it the high-risk age. So far in Oregon, it's killed 10 men and 8 women. So there have been reports about men being more at risk. I don't think we're seeing that proven yet, but in general, men are more at risk because of how we don't take care of ourselves, frankly.
Yeah,
Yeah.
good stuff. I've heard some people, and they've thrown out symptoms.
Yep.
And most of those have held true. Then it seems like they add a couple or.
Right.
It can get, again, and then you have other people that just seem to randomly come up with random stuff. I don't know.
That's right.
And so are the symptoms like a cold or a flu? What are the similarities? What are the differences with COVID-19?
The short answer is yes, but there's a couple of caveats to that. Is from the time you're exposed to COVID-19, you can carry the virus and spread the virus for 10 to 14 days without necessarily being ill. These are people that are called the asymptomatic shedders or spreaders. In general, when people are exposed, they're going to get sick like any other virus within 2 to 3 days. With the COVID-19, it's going to start generally with a fever, initially low grade, but you want to watch and see if it goes up, a scratchy throat, a dry cough, and then the aches and pains that come with any other infection. What you really want to watch for is shortness of breath. And so if you get exposed, the first day that you have symptoms is day 1, not when you're exposed, but the first day that you have symptoms is day 1. Shortness of breath usually starts day 3, day 4. Why do we worry about it? Because shortness of breath can become severe shortness of breath with COVID-19 within 12 to 24 hours. We want you to call your doctor and not go to the emergency room if you're short of breath, and answer some questions and figure out if you need to be seen. And then if you get worse, we want you to call again, not just show up. Now, worse, what does worse mean? That's a gray area. That doesn't help at all. Severe shortness of breath in general you shouldn't be able to talk like I am if you're severe shortness of breath. You're going to have trouble making it through a sentence. If you get up from your chair and you go to the bathroom and you're out of breath and that's not normal for you, that's bad. Going up a flight of stairs, if that's not normal for you to get out of breath, you're short of breath. If you have underlying lung disease, you know better than anybody how short of breath you are from day to day. And if it gets worse, we have to take your word for it. Don't ignore it, whatever you do. That's the big wake-up call, is if you're short of breath.
Yeah. What about, there's a lot being said about testing.
Yep.
Or not testing.
Or not testing.
Not having enough tests.
Not having enough, yep, all of the above.
Not getting the results back quick enough.
Yeah.
What's going on?
Testing's a bone of contention that's being used as a political hockey puck, frankly. We're going to try to dodge all that. I'm going to try. Testing was initially and continues to be limited, and part of that is because it's a brand new virus. We had to develop the test. Testing has been reserved for those who meet the high-risk conditions and are severely ill. In some places that have access to more testing where the virus is really, for lack of a better word, exploding, the testing guidelines have been relaxed. New York City, certain parts of Washington, New Orleans, a couple of cities in Florida, Los Angeles. Those are the ones that jump to mind. In Central Oregon right now, testing is still primarily reserved for those that are high risk and severely ill. Is that okay? I think it's fine, but part of the reason I think it's fine is because we don't have a choice. The other reason I think it's fine is because this is a virus. There is no pill. There's no antibiotic. There is no magic pill for it. Treatment is rest, fluids, and by fluids I mean water, not coffee, not alcohol, and fever control, which brings up something we were talking about.
Yeah.
Right now, for fever control, we want you to use Tylenol or acetaminophen. They're the same thing. There's been reports that using other types of medicine like ibuprofen or Aleve can actually make things worse. Those are being investigated, but right now stick with what we know is that either Tylenol or acetaminophen is safe. If you have some other fever reducer, pain reducer, and the label says a word that's about 16 letters long, like most things in medicine, call your doctor and figure out if it's the right thing to take, or call your pharmacist, even better. They're frankly smarter when it comes to that. I can say that. So anyway, we talked about rest, fluid, water, Tylenol, and we were talking about testing. In the initial phases of the illness, the treatment is the same whether you have a test or not. Where testing would be nice would be tracking the progression of the disease in the community. Well, we have a lot of information on that already, for better or for worse. In the future, testing is going to take on a whole different role as far as identifying who's been exposed and who hasn't, who still needs to stay home, who can go back out, and keeping people healthy without having to have such severe restrictions. There are more tests coming, faster tests coming. Right now, the testing takes anywhere from 3 to 5 days to come back. And the newer tests are going to be anywhere from 45 minutes, which is wonderful. There's even more rapid tests being developed, and I don't know enough about them to speak to their accuracy, so save your question on that.
Yeah. So it seems like, of course, the epicenters are going to be the highly populated areas.
Right.
So our large cities,
Yep.
so forth. So out here
Yeah.
in rural America,
Yep.
in rural Oregon,
Yep.
I mean, they're talking about these big cities being overwhelmed.
Right.
The hospitals and the medical staff. And where do you think, I mean, how do you feel where we stand here in Central Oregon, as it seems like we haven't even begun to hit the tip of this quite yet?
No, I think we're blessed to live in Central Oregon for a lot of reasons.
Again.
Forget what we're talking about, but part of that blessing has some hidden gems to it as well. We are rural, as a matter of fact. Some of us consider us to be remote, but by being rural and being smaller, we're already spread out more than, say, big cities. So we have some inborn.
Well, that was a weird phrase.
Yeah, we have some
That's
inherent.
the Arkansas coming out in you.
Alabama,
Same thing.
Alabama. We have some. Wow. We have some inherent. Meanwhile, back at the topic, we have some inherent social distancing. At the same time, what we're going to see in rural America is that while the big cities are getting this first, ours is coming, and that's not. I'm not trying to sound negative, but we can learn from what they're doing in the big cities, and we'll have a better idea. I hate that anybody has to be the guinea pig.
Right.
I'm glad I'm not the guinea pig, but yeah, that's, so there's benefits and the detriments to being in smaller rural America is that as the new tests come out, as the larger scale testing comes out, we're going to get those after the big cities too. It's just the way it is because of population health management.
Okay.
Yeah.
Yeah. Good answer.
Yeah.
I like the word scaly. So go ahead. We got a question.
Long-time listener, first-time caller wants to know why you guys are sitting so close.
Well, okay, right.
He's a late joiner.
Yes, I had nothing to do with the seating.
Me either.
Perfect, right. Technically.
Camera's only so wide.
Well,
Yeah.
yeah, it's true. The camera's only so wide, and I'm not getting any less wide.
Yeah. So we've got 3 cameras on us right now. So
Right.
that's 30 pounds.
That's 30
right?
pounds. There we go.
Suck it in, man.
I can't hold my
Sit
breath.
up
though.
straight. I know. I can't hold my breath that long either.
Okay.
That was really the question. Do we got any other questions?
No.
Nope. That's it so far. I know. That means-
Crickets.
I know. That means I need to go back to my list here. Oh, here's one.
Okay.
And of course, if you've ever watched Seinfeld, the soup Nazi
Yes.
might have something to do with this. But it says in here, with all the media, it's hard to know what's true and what's not. Did COVID-19 really start from someone eating bat soup in
Okay.
China?
All right. What do we know? We know that COVID started in China. We know that all indicators point to the fact that it arose, and they tracked it through its original cases, to a market in Wuhan, China, I hope I'm saying that right, that is known for the sell and trade of exotic and wild animals. So COVID-19 is a zoonotic infection, meaning it came from animals and got to humans. So it all makes sense. The worrisome part about it is how easily we can spread it to one another. Other zoonotic infections in the past have not been this easily spread. This is what happens as we grow as a culture and a human race, and we go into parts of the world that we haven't been before. Asia, the Amazon. We get into things that our bodies haven't seen before. I don't know if they ate the bat or if they just traded for the bat.
Yeah,
So,
I don't know either. I heard Ozzy took a bite of a bat once, but that's a whole other story.
yeah, he's at risk.
Yeah, probably, he's really old too. Yeah.
Yeah, I hope not.
Yeah. You got another question?
Yep.
Yep.
Susie on Facebook wants to know if we should be wearing masks.
Oh, we're getting there. Perfect.
Yeah,
All right, so let's talk about prevention of transmission. And this is a timely story because if you follow the news, I didn't touch my face. That's timely. I touched my ear. If you follow the news, the CDC, or the Centers for Disease Control, is considering a recommendation that people start wearing masks whenever they go out. That's the headline that you're going to see. Let me really briefly say you need to read the whole article. And what they're saying is that people, if they recommend this, will need to wear a fabric mask, not a surgical mask, not a medical mask. The medical mask and the surgical mask need to be reserved for those at highest risk giving health care or receiving health care in a facility. There's already shortages that you're reading about. The virus has been studied, and it can last on a solid surface like this chair for 3 to 5 days. So if something lasts for 3 to 5 days on this chair, it means it lasts for 3 to 5 days on countertops, on coats, handles, money, bags, and boxes. So if you're saying prayers, say prayers for your mailman and your UPS man as well, because nobody probably thinks that they're exposed any more than anybody else. So what can we do? I'm not being selfish when I say that we need to not use surgical mask, medical mask, and gloves. We need to get those to the places that need them. We need to get them to the hospitals. The system that I work in is based out of Portland, and it has recalled all of its personal protective equipment from the clinic I work in, with the exception of just enough to keep us running on a day-to-day basis. At any given time in our clinic, we normally have 160 boxes of gloves. We have 6. We normally have boxes upon boxes upon boxes of masks. We have 1 box of masks. We sent them all back to the hospital in Portland so that they have them where they need them. If they can't keep my clinic, the clinic I work at, supplied with personal protective equipment, they'll shut us down. We don't want them to shut down the hospital.
No.
So the problem with surgical masks is that they haven't been shown to do you a lot more good than a fiber mesh mask, fabric mesh mask that you can make for yourself. You can go online if you're a sewer and get the plans. The big scuttlebutt has been a certain type of mask called an N95 mask. An N95 mask is a very effective mask if you've been fitted and tested for it. And by fitted and tested, I mean they fit it to your face, they put you in a room, and they expose you to basically smoke and see if anything gets in. I don't think any of you have been through that. If you're using an N95 mask, there's people that need it more than you. And furthermore, if your N95 doesn't fit correctly, you could be trapping more stuff in your mask that you're just rebreathing. That's really not the idea behind it. Gloves, let's talk about gloves. I'm talking about surgical gloves or latex gloves. Latex gloves are solid. They're solid surface. The virus lasts for 3 to 5 days on that glove, and then you touch your face, you're in trouble. Do you need gloves? I think what you're going to see the CDC say, that's a fun one, is if you're going to go out, then wear a glove. Wear a cotton glove, and then wash it as soon as you get home. Wear a bandana, wash it as soon as you get home. But don't be using medical supplies when they're not proven to be doing you any good, and furthermore, they're needed elsewhere.
Okay,
Does that help?
yeah,
A note
excellent.
on the mask, another question, if you were asked if a smog mask would help.
I'm going to claim ignorance on the smog mask.
I don't know what that is.
Yeah, I'm just going to, I have no idea on the smog mask.
Instagram viewer wants to know if you can address pregnancy and COVID.
I think the smartest answer for me to say on that is no, I can't. It's been way too many years since I've been involved in that field. Call your doctor.
Yeah.
As far, other things we can do to protect ourselves, so if the CDC is going to come out and tell us to wear gloves and fabric mask, okay, that's a big step for us. We're not used to that. What else can we do? Well, there's no more important commandment than to love our neighbors like we love ourselves. So when I hear people say that I'm not afraid of the COVID virus, I'm not worried about getting it, my first inclination is, well, I am. And have you talked to your spouse about this? It's usually the guys. We need to maintain our distance. We need to keep up with our social distancing. If you go on any of the website, any of the big news services right now, there's reports out of all around the world, but in particular at home, Washington, New York, and Oregon, that the social distancing is working, that the curve is starting to flatten, which we're going to review, that the cases are getting spread out. What else can we do to help do this? Shopping for some people is really fun. It's right there with going to the dentist for me. So
Same.
Yeah. So I would approach shopping in the following way. Number one, I would minimize the amount of times you do it. I would wait until you have to go for something and then get everything at once. I would get in and get out. Unlike normal times, when you go shopping in these days, this is not the time to socialize, and this is not the time to comparison shop and pick everything up. If you're picking everything up and reading labels, everybody else has as well, okay? Stick with what you know, get in, get out. Wash your hands before you go in. If you're gonna use a cart, take a wipe, take some Purell, wipe down the handle, get your groceries, check out, come home, unload your groceries, and wash your groceries. Meaning, I'm gonna tell you to wash your hands and wash your hands and wash your hands. When you wash your hands, hot, soapy water, 20 seconds. What's that mean? It means you're scrubbing your hands with hot, soapy water while you sing the ABC song, or while you sing Happy Birthday to Me twice. Do the same for your vegetables. Do the same for your groceries. If you don't feel like, if you've got a container of groceries that you can't put under hot water, okay, use a wipe, use a spray. If something comes in a box, wheat thins or cereal, open the box, take the bag out, ditch the box. The baggie's clean. That's good. Where to put the box? Put the box in the garage, put the box on the porch. What about the clothes you wore? I'm not trying to sound paranoid. When I come home from the clinic every day, I wash the clothes I wore that day, whether they're dirty or not. If you can't do laundry every day, I realize that's a real concern. Fine, take a hanger, take your jacket, take your clothes, put them in the garage, put them on the porch 3 days, let them air out, let the little virus die off, then wear them again. If you don't have that many clothes, get as close to that as you can. Do your best not to touch your face. I've done good. I haven't touched my face. Have you touched
same.
your face?
No, but I'm so bad at that. I don't know how many other people are, but yes, and if you wear glasses too.
Wear glasses.
Man, it's constant. I know, right? And it's just, I'm constantly touching my face. So
brutal.
I'm not trying to touch mine or yours right now, so this is good.
I like that.
Yeah.
Okay. We were talking beforehand, if you're at increased risk or if you're really scared, use the curbside delivery that's available at your grocery store.
Yeah.
And as much as I hate to say it, these are desperate times. You might actually have to make and drink your own coffee.
What?
I know. I'm sorry.
Oh my goodness.
I know they're open, but if you're really worried about it and you want to take the full step, you got to do it.
Yeah.
You got to do it.
You just answered a question from Ashley who said Uncle Bruce was asking if she should disinfect the groceries that she orders for pickup when she's putting them away. You kind of just answered that.
I'd say yes to Ashley, and I'd say happy belated birthday to Gabe.
Happy belated birthday, Gabe.
Absolutely. So, that's all taking care of yourself on the straight infectious disease part of it and the exposure part. If any of you have already been at home and you're not used to being home, and there's other family members that aren't used to being home, it can get a little stressful, it can get a little tight. I'm the kind of person that needs a few minutes / hours of quiet time, and when you're all under one roof, that doesn't always happen. the mental health strain of being locked in and having some of your basic freedoms taken away are very real. My sister, the aerospace engineer, so she's smart, sent me an article referencing what do astronauts do, because they're isolated.
Oh,
They're
wow.
all about this,
Yeah,
right?
yeah.
One of the main things that they use is education. They're fully aware of what they're going through, they're fully aware of what their risks are, and they're fully aware of what has to happen for them to get back home safely. I'm hoping the talk does some of this,
Yeah.
dispel some of the fear. But there's other things you can do. Social media, never thought I'd say this, thank God for social media, it's helping. My 17-year-old, thank God for Xbox Live, he can stay in contact with his friends.
Yeah.
Call people,
Yeah.
write someone a letter. I can't think of the last time I've done that,
Yeah.
so.
Yep. Shalene, you had another
Sharon is
question?
asking, have you heard about the possibility of an anti-malarial med helping with COVID-19?
Oh, yeah. All right, everybody's taking my talking points, so.
That's excellent.
Yeah, it's excellent. There's been talk from a lot of people in the press, most of them non-medical, most of them political, about wonder medications that are going to be a breakthrough. These are very old medicines that we've used for malaria for years, and right now they are being used, but they're not the magic pill. Anybody touting them as the magic pill is not being responsible. Furthermore, I'd point out that a lot of arthritis patients use these medications on a daily basis just to live with their arthritis.
Wow.
These are old medicines. They're not made in high quantity anymore. I'm hopeful that we find something that works really well, but let's not go hoarding that either.
Right, right. Tim, did you have a question? No.
Alina, why tests done with cold or heat treating for disinfection?
Again, sorry.
Heat, cold or heat treating for disinfection?
Right. Okay, I got the question now. So are other modalities good for disinfecting surfaces? Hot, cold, whatever we can have. Right now, I don't think those are widely open modalities for most people. Nothing beats soap and water, warm, runny water. Warm, runny water? Warm, running.
I've heard it both ways.
Heat and cold modalities, I don't know enough about, but I know what works, and that's soap and water, so.
Bridget on Facebook wants to know how hospital and healthcare workers, floor nurses, should be protecting their families.
Yeah, it's a great unknown. Right now at work, people are screened when they come in for symptoms. And if they have any symptoms, fever, then they're sent home. What about their families? People have gone so as far as to rent their own places during this so they don't expose their family, or send people to their grandparents' house, which I don't think is a bad idea. I just can't imagine having to do it. Again, I think that if you work in the environment and you come home and you wash your clothes and you shower yourself and you wash your hands, then you're doing what you can do. If you develop symptoms, then you're going to be quarantined. If you are exposed, then either your employer or county health is going to quarantine you, at which case there will be direct recommendations of what to do about your family, such as you get your own room, you get your own space, you get your own bathroom. It's going to be tough with little kids.
Yeah.
But there's some very clear-cut guidelines to do that. But again, it breaks down to hygiene is what it breaks down to, so.
Yeah, and I've heard lately about a lot of people, even if they test positive, they're not necessarily treating them in the hospital, but having them go home and self-quarantine.
Yeah.
And so that's kind of a hopeful sign in my mind, you know, and that some aren't as bad.
Right.
But even like you said, I mean, here we are living so close to each other. And so what does that self-quarantine look like? Locking in yourself in the room and staying away from the other family members who probably at this point would maybe test positive with it too.
They might. If I was in the situation that I knew that I had it and my wife and my youngest still live at home, I would take over the downstairs and kick my son out. It's not where I want to live if you've seen his room, but I would take it. And they would be upstairs. And I'd have my own bathroom. I guess I would ask them to drop food down to me on occasion.
There you go. Got another question from
Sean on Facebook says, hey Bruce, question for Christina and I, is it okay to volunteer for needed services like food banks or blood drives if we are healthy and not interacting with higher risk population, or is it better to just stay at home?
Sean and Cristina in Philadelphia. Absolutely. Why? Because you're young and healthy. Disgustingly young and healthy, as a matter of fact. Yes, and furthermore, in addition to calling people, to getting your own time, your own space, the more you can do for other people in general, the better you're going to feel. Sean and Cristina are late 20s, 30s, and they're perfectly healthy. And if they want to go out and volunteer, they got to wash their hands.
Yeah.
But they're going to help far more than they're going to hurt anybody. And at the same time, if they get exposed, then they are going to be quarantined. But if that's a risk that in their heart they're willing to take, then God bless them.
Yeah. We were talking about this off camera before we started, and that is, I mean, this thing's kind of coming right into the spring season.
Yeah.
And for a lot of us allergy sufferers, we know what spring means.
Right.
And so it's on the tip of both COVID-19 and the allergy season.
Yeah.
And again, I guess it goes back to that symptoms talk, or
Right.
even not freaking out if someone sneezes.
Well, I woke up with a scratchy throat a couple of mornings ago and made the mistake of asking my wife if I had snored the night before, and of course the answer was yes. Well, that explains my throat. But of course I went down the rabbit hole like anybody else would. Oh my gosh, here I go. I'm, knock on wood, I don't have really bad allergies.
just got that.
Yeah, knock on wood. I don't have really bad allergies, but people who, after years of treating people with allergies, they know their allergy symptoms. So
Yeah.
when someone calls me, do I have allergies or do I have COVID? Do these feel like your normal allergies? Well, then yes, they do. Well, then you have allergies. Take your medicines, and if they relieve them, then good. If not, and you get a fever, and if you get short of breath, we need to talk again. So,
Yeah. Okay. Got another question?
wow.
Mike says, Bruce, thanks for all you do. Miss you. And then Karen is also asking if they aren't testing everyone, how is quarantine helping?
Great question.
And somebody else on Instagram said you always snore.
Maybe that wasn't on camera, but okay. All right, so how does quarantine work?
How is it helping if they're not
How's it
testing
helping?
everyone?
All right. So the virus came from China. We attempted to isolate it in China. That didn't work. We tried to contain it. Sorry, not isolate it. We tried to contain it in China. It didn't work. It's now everywhere, okay? It's everywhere. If you go on Oregon, every county has at least one case, okay? So that's fact one. Fact two is that we know people can carry the virus for up to 14 days without showing symptoms. That's a fact, okay? So if you know it's everywhere and you know there's people carrying it around without symptoms for 14 days and you're isolating or quarantining, then you're putting people away from other people until they can't spread the virus anymore. That's how quarantining works. I'm going to get to more of that in a little bit. But quarantining is proven, whether you want to call it social distancing or quarantining, it's proven and it's working.
Yeah, seems to be. That's for sure. When it comes to, and so social distancing, luckily the weather had turned bad here.
Yeah.
And so it kind of helps keep us
Right.
Indoors. But inevitably, as this continues on, we're going to get some nicer weather and want to get out for walks or bike rides. And I mean, encouraged or discouraged about that? Discouraged about that?
Well, number one, I think it's good for your health. Number two, I know it's good for my mental health.
Yeah.
And so, yes, but you have to do it responsibly.
Yes.
So that means that you go hiking with one or two other people if there's two other people in your house. You don't meet up for other people. If you're on a walking trail and people are coming your way, well, get your 6 feet apart, unlike us, and now's not the time for your dogs to do their thing. Just, that's a cute dog and that's a cute dog. How you doing? Keep walking. Don't be rude, but do it that way. It's totally different than a gob of people on a beach or people at a concert. You're walking, you're in fresh air, it's circulating, it's good for you, it's good for everybody. I've seen more people walking where I live in the last 2 weeks
Yeah.
than ever. It's great. It's
Yeah.
wonderful, so.
Yeah, agreed. You mentioned dogs. I read an article just 2 days ago about a cat testing positive for coronavirus. And I laughed because, one, how I feel about cats, but two, I guess my question would be, have you heard anything about animals carrying it? Obviously, it possibly originated from an exotic animal, but what about our domestic ones?
No,
Okay.
no. Now, I would say that, however, a cat is a solid surface, as is a dog. So I guess if someone's sick, gets all over an animal and coughs on it and gets respiratory secretions on it, theoretically, but no. No, there's been no proven transmission from owner to pet to owner or pet to owner to pet, either way, so.
Yeah. Good. So one of the other questions I wanted to get to, and I think a lot of people have heard this phrase because it keeps getting thrown out over and over again. And that's the whole phrase of flattening the curve. And so what does that mean? What does that look like? I want to make sure that we cover that so people have a general understanding as it keeps getting thrown everywhere
Yeah.
in media outlets.
Flattening the curve when it came out was not well understood, and actually that was the whole reason that we talked about setting this up 2 weeks ago, and the world has changed.
Yeah.
And the problem that I find with most people, you go to read about flattening the curve, and the first thing you run into are these huge numbers and these 14-letter words. And so flattening the curve, there's a couple of ways to look at it. I have a couple of ways to look at it. I'll run through both of them, but I'm gonna have to use my cheat sheet, so I'm sorry. For flattening the curve, there's a few things we have to accept, and we went over them earlier, is that number one, trying to contain the virus has failed. It's everywhere now. And that number two, like the Centers for Disease Control and our president spoke about today, we have to accept the fact that a portion of the entire population is going to get infected with coronavirus. And that therefore a large number of people are going to get sick. And a large number of people are going to get very sick and need hospital-level care. If we spread out, if we slow the spread of the virus by distancing, and people get the virus over a longer period of time, then those who get very sick don't all come at once, and the system is not overwhelmed. If we can keep that number of people to a minimum over a longer period of time, the overall number of people that get the virus doesn't change. The overall number of people that can get the care they need is more. And the other part that's hidden is that if the system is overwhelmed, then people who need routine care for more boring, common diagnoses like heart attacks or strokes can get that care as well.
That's good.
If the system's overwhelmed, nobody can get what they need. That's the straight talk. I broke this down for a friend of mine in sports terms.
Yay.
Yay, right. So in January, there was a playoff game between the Texans and the Chiefs. Started out okay. The Texans' offense was moving the ball and keeping the Chiefs off the field. The Texans even scored. And then something happened. And the Kansas City Chiefs scored 28 points in 10 minutes.
Yep.
Why? I'm not even sure there was a turnover, but the Texans couldn't do a thing on offense, and their defense got wiped out, and their defense couldn't keep the Chiefs out of the end zone, and they scored 28 points in 10 minutes, and by then, the game was over. That's not flattening the curve. If the Texans' defense could have stood up and flattened the curve, spread some time, spread the points out, we might not have the same Super Bowl champion. That's very basic, but that's the numbers, and it's no different, really, than what we're trying to do here.
So stay home.
So stay home. Wash your hands.
That's right.
Wash your hands.
Yes.
Wash your hands.
Wash your hands.
Quit
Wash your
smoking.
hands. Quit smoking, yes,
always quit smoking. Yes,
Always.
yes.
Shalene, any other questions from there? What have we not covered that you wanted to cover?
The last question that came in on Instagram this morning.
Yes. It says, do you think this virus will come back around like influenza does? And will it be as monumental as it is the first time? So kind of a two-part question.
Right. So do I think that the virus is going to come back around on a seasonal basis like the flu does? It would be really obvious just to say, man, I hope and pray it doesn't. Other viruses that have come, MERS and SARS, have not come back on a seasonal basis. However, flu always comes back. I truly hope and pray that this one doesn't come back on an annual basis. However, if that's better than having it always around, I'll take that. We would have time to develop, number one, better testing and monitoring, treatment, and ultimately an immunization. So it doesn't have to be as monumental as it is this time. The truth of the matter is that nobody knows, or if anybody knows, they're not talking about it. So
Yeah.
I really hope not.
The snoring comment was by your son, by the way.
Oh. Which one?
He's watching you. Bambi.
Oh, okay.
He knows where you live. That's
All right.
too funny. Was there, like I said, I know you and I kind of went through some stuff. Was there anything you wanted to cover as well that we have not covered or mentioned?
You're right. I wanted to cover this number down here in the bottom that we keep saying to call and call and call. And yes, your own personal doctor is a great source, in particular if you have a specific question about your medication or one of your underlying health conditions. Your pharmacist is a great resource if it's a medication question. But if they're busy or you just have another question and you need it, then you can call this number. It's been set up locally and it's wonderful. It's who we refer people to. There's a couple of more things I'd like to mention is that our local hospital system here is doing everything it can to be ready. If you watch the news, they follow the lead of other organizations and they've eliminated routine doctor's appointments. They're only seeing emergencies. This isn't about the cost of that, but they are sacrificing that as well.
Yeah.
What they're doing is that they're redistributing their resources and their people towards the hospital. And they're being responsible with their own employees to not expose them. And frankly, with people who might be scheduled for a physical or to have a shoulder injection that it's not worth risking your life for. And that can be frustrating, but we all have to make sacrifices at this time.
Right.
Furthermore, the hospital system in Central Oregon is doing its best to almost double its capacity with what they see coming. That's a huge amount of effort and work. The hospital system I work for, it's the VA. The hospital in Portland has not only, doing the math, quadrupled its emergency room capacity, it's tripled its inpatient capacity, and it's expanded its intensive care capacity by 5-fold. All of this is in anticipation of the surge or the wave that's coming, and all of this is sacrificing their bottom line and sacrificing what you guys are used to having done for your normal medical care. It's all for the right things, and what's being done is being done at a remarkable speed. I'm amazed at what is being done. I have actual numbers that I was going to share. I don't want to scare anybody, but in Central Oregon, we have 240,000 people. We're going to be, I'm an optimist. We're going to be optimistic because we're rural and we're already spread out. And we're going to say that 25% of us get exposed and get infected with the COVID virus. That's 60,000 people. We know, thankfully, that 80% of those 60,000 will get sick, but they'll be mild or moderate and they'll be able to stay home. That's 48,000 people. That leaves 12,000 people. Of those 12,000 people, and again, there's a lot of numbers, but of those 12,000 people, about half of those people are going to need intensive hospital care. That's 6,000 people. Our local hospital is going to double its capacity to 500. We got 6,000, we got 500. If we don't spread this out, flatten the curve, then all 6,000 hit at once in the hospitals down here. We flatten the curve, spread that out over time, the hospital can do its job and more people can not just survive COVID, but survive everything else that they use the hospital for. It's working. We can turn the tsunami into a high tide.
Yeah.
And what you're seeing as well, and this is rosy, is you're seeing some of the best of our own nature come out. The changes that the hospital is making. Tesla using its production facility to make and donate 1,000 ventilators to the state of California. Dyson, who makes an amazing vacuum cleaner, took 10 days to design a ventilator and is now mass producing them. Auto manufacturers are following in
Wow.
suit. Testing companies are doing the same. There's a jersey and uniform maker for the major leagues that has changed its factory to make nothing but scrubs and masks for healthcare providers on the East Coast. Everybody has to do something. That's extraordinary.
Yeah. I think one of the things that we can do as we wrap up too here is don't give in to fear, don't give in to panic. I've never seen those ever help any situation. And so for those of us that are faith-based, our faith is in Jesus. Of course, he is our peace. And we don't know what the final outcome of this is going to look like, but it is an opportunity for us to lead the way in trusting in him, in being hopeful, in sharing his love and sharing his peace, and serving one another, even if it's at a distance. There are ways that we can do to continue to connect and help and love on each other. Again, some great information here. If you are catching this right now, great. If not, it'll be on our YouTube channel, our Desert Song Community Church YouTube channel as well later. And you can rewatch it if you like. But anyway, thank you, Dr. Bruce,
Thank you,
for
Pastor Chuck.
taking some time and doing this. And it's great to have you here and part of our congregation and community as well. But I just want to pray right now as we just close up. Heavenly Father, we just thank you again of all that's being done, and we just give you the glory for that. And Lord, even as worry and doubt and fear and panic do set in, Lord, I pray that we turn our attention to you and that we ask and receive you, calming our minds, calming our hearts, calming our spirits, that you help us use the brain that you blessed us with and just begin to walk out those things that you would call wisdom and discernment. Again, I just ask you minister to anyone that is fearful right now, and that you just fill them with hope and peace. And we pray that in Jesus' name. Amen.
Amen.
Amen. Well, thanks for tuning in. We appreciate it. And thanks to Tim Park and Shalene for being here and helping us with this. And for Kayla making faces at us. So have a great night. God bless.